Okay, should be live. Go for it.
All right, good afternoon, ladies and gentlemen, and welcome to this public meeting of the Board of Garrett County Commissioners for Monday, August 3rd, 2020. I want to welcome everybody. Thank you for tuning in. We'll get right to the business agenda. Mr. Knoll, do you have any additions, deletions, or corrections to the public meeting agenda?
No, sir, I do not.
Hearing none, do we have a motion to approve the meeting agenda?
So moved.
We have a motion. We have a second.
Second.
We have a second. Agenda approved by mutual consent. Everybody got a copy of the minutes in advance of the meeting. Are there any additions, corrections, or concerns with the minutes? Hearing none, do we have a motion to approve?
Motion to approve.
Commissioner Titchnell, we have a second.
Second.
Commissioner Heimball, all those in favor say aye.
Aye.
Opposed, motion carries. The first item on the agenda, we do have with us today Garrett County Health Officer Bob Stevens. We appreciate you finding time to join us. And Bob, I'll turn it over to you for an update from the health department.
Good afternoon, gentlemen. Thanks for having me. First thing I'd like to say is the slogan of the Garrett County Health Department is working together for a healthier tomorrow. And with COVID-19, we've had some successes within our community, and we rely on the community to help us to continue to have those successes because we all really do need to work together, all the different agencies and organizations and businesses. So far, we have 46 positive cases in the county. We have a 0.06 positivity, 14-day positivity rate, which is the lowest in the state. The state's pretty proud that they've been able to be under 5% for about the last 3 weeks or so. But we are the lowest in the state at this time. We're glad to have that. A lot of the success is because of the result of the social distancing and the general compliance of citizens and visitors, although there are a few problems, and it seems like we get a lot of those complaints. There's no current health orders under that are in place other than what's in the executive order from the governor. And so those, in other words, what that means is we haven't implemented anything locally at this point that is any more restrictive than what the state has. And we'd like to keep it that way because the best way to do that is for everybody to comply with what is already in place with the state, because we've had some successes there. It's important that we stay vigilant and so we don't have to implement any additional restrictions. We do continue to have complaints, and we take each complaint really seriously. But we do not have the staffing to track down every one of those and going on site. It's just with everything else that we're doing, it's just impossible to track all of those things down. So we really rely on citizens to help us out so that when they observe individuals that are not following the guidelines, if they would themselves make general reminders to the people, maybe speak to the managers when they observe a problem, because it truly is a community problem, and when we don't see people being compliant, and you know, we really need to work at this all together. We can go in and we do inspect from time to time, but most of the vast majority of our businesses are very compliant. The vast majority of our citizens is just a couple of outliers that are there. And I say that because Garrett County is not immune to the epidemic. One of the things that we know is that on some of those areas that are experiencing surges right now, while their numbers are not as high as Maryland, but Maryland's numbers have plateaued again, but there are a number of states that are going up, and a lot of those are very rural states, places like Idaho and Oklahoma, Nebraska. Those are places where things are going up really quickly, and actually in West Virginia they're seeing that too, although their case numbers are still relatively low. So we want to address that. We're also ramping up for flu season. We'll be scheduling some flu clinics in the very near future. We have some tentative dates set up, and it'll look a little different than in the past, because in the past we worked with the schools to do some especially with in order to do some of the clinics in the schools. We're not that might be more difficult now, but we will be doing flu clinics. And the reason why that is so important with COVID is that when you both the flu and the coronavirus are both create some respiratory distress issues that can result in people being in the hospital, and we do not want to overwhelm our system. And so the best way to do that is to have a situation where more people are immune. So we can't, there's currently no vaccine for coronavirus, but there is one for the flu. And the match, they say this year, is a pretty good match. So hopefully it'll be okay. The other thing I do want to bring up, and I think I spoke to you before about the fact that this is a pandemic. We've been in a pandemic state since March, but for the past number of years, we've also had an epidemic within this country and within Maryland, and that has to do with drug overdoses. And so our drug intoxication deaths so far this year are higher than what they've been during any 6-month period we've had in the past. Last year, there were 10 drug overdose deaths in Garrett County. And unless we stop right now, we're going to pass that. And I think a lot of that has to do with a number of different factors. The biggest factor is that fentanyl is being peddled on the street more than anything else. I heard a presentation just today where they said, heroin's going to be a thing of the past soon because nobody's interested in heroin because fentanyl is so much cheaper and so much more powerful. And we're seeing people that are overdosing that maybe in the past they might not have overdosed because they weren't doing the drugs that had that potential for overdose. But fentanyl is being because it is so potent, is being sprayed on different drugs. It's even being sprayed on marijuana, and it's being sold as other drugs sometimes and being cut. And so we're seeing a lot of that. The other thing that kind of leads to that is that the overdose intoxication deaths, as well as the general overdoses, is the fact that we have, because of the pandemic, there's a lot of people who are feeling socially isolated. There are some people that have that because of the payment they received from the federal government as a stimulus package. They had expendable income, and we really believe that some of those things have also contributed to that. So we're changing our outreach and prevention methods to deal with this epidemic. It's really changed the way we've had to do business with our behavioral health clinics and the behavioral health providers in the community. All the behavioral health providers are continuing to see patients. Some are on a limited basis. There's certainly one of the things that we relied on in the past was group therapy, because that's the best thing for people who are trying to deal with an addiction and treatment. We can't do the group therapy, so it's one-on-one and often through telehealth. And that's just, while it's a help, it's just not as good as a real face-to-face. We're also changing some of the other things that we're doing as far as outreach with some of our programs to try to get that out in the community. So I want to let people know in this format is that we still have treatment that is available. People who are interested, they can, the treatment, the Garrett Health and Wellness, operated by the hospital. There are a couple other private providers that provide treatment. And then our addictions clinic is also accepting new patients, and for an appointment, it's 301-334-7670. Also, if somebody is in need of Narcan, and then which is the medication that is used to counteract a drug overdose, they can reach out to us at the health department, and we can provide that. Outside of that, other things, we're just staying really busy and trying to adapt our operations to best meet the needs of the community while keeping the community safe. So if you have any questions, I'd be glad to answer those.
Questions?
No, thank you.
All right, Bob, like I said, we appreciate you always finding the time to join us and give an update to us and to the citizens, and always appreciate the job the health department's doing.
Okay, thank you and have a good day.
Thank you very much. Okay, the next item on the business agenda, we have some bids to award. Mr. Knoll, I'll turn it over to you, and we'll take all of them at one time.
Okay. Yes, sir. So we have 3 bid awards for consideration today. The first one is for the Garrett County Health Center exterior lighting retrofit. It's project bid number 20-0625. This involves the replacement of the parking lot lights with energy efficient lighting. Funding for this project comes from the Maryland Energy Administration Smart Energy Communities Grant in the amount of $15,480. Potomac Edison rebates in the amount of $10,350, and county funds in the amount of $40,000. We received 6 bids, but only 4 of the bids actually included the aluminum light poles. So the bids were from Beitzel Corp. in the amount of $39,098.20. Evergreen Electric in the amount of $56,437. S&S Electric in the amount of $72,385. And Zero Draft in Maryland in the amount of $84,110.06. So the purchasing department is recommending awarding the bid to the apparent low bidder, Beitzel Corporation, in the amount of $39,098.20.
Any questions on the retrofit project? So just for clarification, Mr. Knoll, for the public, we budgeted $40,000 for this project. Of course, if the bid comes in below that amount, the community's grant money from Smart Energy, MEA, and the Potomac Edison rebates, those numbers are what they are.
Correct.
So we're going to come in significantly under budget.
That is correct.
I just wanted to point that out. If there are no questions on that, let's take the next one as well.
Okay, the next bid is the Emergency Operations Center automatic sprinkler and fire alarm systems installation bid. This is bid number 20-76-16. We received 1 bid from Pillar Innovations on this project in the amount of $90,987. So our recommendation from the purchasing department is to award the bid to Pillar Innovations in the amount of $90,987.
Questions on that? All right, and we'll take the third one then.
Okay, the final one for this evening is the Garrett County Airport West Wing construction contract. This is bid number 2019-01. This project is 100% funded through the FAA. We did receive 10 bids on this project. Beitzel Corporation in the amount of $4,352,978.65. Carl Belt Incorporated in the amount of $4,633,043.90. Excavating Associates in the amount of $4,466,684. Bear Contracting in the amount of $4,698,932.80. All Construction in the amount of $5,110,507. Green Rivers Group in the amount of $5,184,826. Mountaineer Infrastructure in the amount of $5,189,973.10. Charles J. Merlot Incorporated in the amount of $559,000. First Fruits Excavating in the amount of $5,907,987. And Eastern Branch Demolition in the amount of $6,049,196. The purchasing department recommends awarding this bid to Beitzel Corporation in the amount of $4,352,978.56. And these bids have all been reviewed, and the recommendation has been also approved by the FAA for funding.
Okay, any questions on the Garrett County Airport project? All right, hearing no questions on any of the three projects, can I have a motion to accept bid number 20-0625 awarded to Beitzel Corporation, bid number 20-0716 awarded to Pillar Innovations, and bid number 2019-01 awarded to Beitzel Corporation?
Make a motion that we accept these bids.
All right, motion by Commissioner Tisdale. Do we have a second?
Second.
Second by Commissioner Heimball. Question on the motion?
Just a comment that it's good to see this work going to local companies.
Absolutely.
Yeah, very much.
Yep. If there are no other questions or comments, all those in favor say aye. Opposed? Motion carries. Thank you very much, Mr. Knoll. Next and final item on the agenda is an update on the Second Amendment resolution that had been requested of county government. This is an issue that was highly engaging with the public. We received more comment and letters and emails on this than any other topic that we've had since the three of us have been elected as commissioners for the last 6 years. So it like I said, was extremely engaging and emotional with the public. We had talked about this all the way back in January and February. We had some of our meetings that we took on the road. We had some engagement with folks there. Then we gave, because it was so emotional for folks, we actually gave a 4-week comment period before we acted or did anything with this. And then, of course, we ran into COVID and we were at home, so we didn't want to do anything with it while we were there. So we delayed it some more. We were able to get back in here together. We wanted to wait until we could have folks back in the courthouse, but we don't know when that is going to be. And one of the things that we have prided ourselves on and tried to do as much as we can is to be able to make timely decisions. We have had this on our radar now for upwards of 8 months or longer. And in consultation with the Sheriff's Department and the elected sheriff, I do want to read the resolution number 2020-5 and then open it up for any discussion if we want to entertain a motion to approve. And again, working with Sheriff Corley, who had a investment in this, a lot of public outreach to him as well. We have resolution number 2020-5, Garrett County Government Support for the Second Amendment to the United States Constitution, Garrett County, Second Amendment Preservation County. Whereas the Constitution of the United States is the supreme law of our nation, and whereas the Second Amendment to the Constitution of the United States of America states, quote, a well-regulated militia being necessary to the security of a free state, the right of the people to keep and bear arms shall not be infringed, end quote. And whereas the Board of County Commissioners for Garrett County wishes to express its deep commitment to the rights of all citizens of Garrett County to keep and bear arms, and whereas the Board of County Commissioners for Garrett County wishes to express opposition to any law that would unconstitutionally restrict the rights under the Second Amendment of the U.S. Constitution and under the Maryland Constitution of the citizens of Garrett County to keep and bear arms, and whereas The Board of County Commissioners for Garrett County wishes to express its intent to stand for the preservation of the Second Amendment rights and to oppose, within the limits of the constitutions of the United States and the state of Maryland, any efforts to unconstitutionally restrict such rights and to use such legal means at its disposal to protect the rights of citizens to keep and bear arms. Now therefore be it resolved by the Board of County Commissioners for Garrett County that the Board of Commissioners hereby declares Garrett County, Maryland as a Second Amendment preservation county, adopted this 3rd day of August, 2020. And before we take questions or comments or entertain a motion, as I mentioned, we received an outpouring of comments on this issue. Overwhelmingly, people are in favor of the resolution. And so I'll open it up and see if there are any comments or entertain a motion to approve the resolution.
Well, the only comment I would have is that, as you've already stated, just to reinforce that we got an awful lot of feedback on this, a lot of input. I think you're right. I think we probably got more input and feedback than we did even over fracking, which was very controversial. And as you pointed out, the vast majority, I don't know what the percentage was, but the vast majority of the input we got, the feedback we got was in favor of this. So it's pretty clear to me that a significant majority of the county wants us to act on this and to make some kind of a statement or expression of the county's support for the Second Amendment. I think what you read in this resolution is an appropriate and fitting way to do that.
And I would agree with what Jim just said, and I wholeheartedly agree that we had a lot of people that were, in favor and not in favor of this, but overwhelmingly wanting this to happen. And therefore, when I was elected, I said I would listen to the people of the county, and I think I've overwhelmingly heard that they want this to happen, and I will make a motion that we adopt this resolution.
All right, we have a motion on the floor from Commissioner Tishnell. Do we have a second?
Second.
Motion and a second. Question on the motion. All those in favor say aye. Opposed? Motion carries. With that, I would like to announce that the next public meeting will be Tuesday, August the 18th. Again, we will be virtual on that. Look for the agenda to come out a week in advance of that meeting. And if there are no other questions, comments, or orders of business for the county, I will take a motion to adjourn.
So moved.
Motion adjourned. Thank you all very much.